Remember your favourite teachers at school or lecturers at university who, by planting the seeds of curiosity and imagination and developing a real love of knowledge, inspired you to achieve more on your learning journey, helping you become the educator you are today. Now it's your turn to prepare students for successful lives in a more complex world. Imagine having the certainty that no matter how new discoveries transform our future, your students always have the right skills and knowledge to thrive in it, to appreciate different realities and viewpoints, to create a fairer and more inclusive vision of the world and pass it on to future generations. At Macmillan Education, we make this happen by working hand in hand with teachers and academics, building on our long-standing heritage of innovation in literature, science and education. We connect, we innovate, we inspire. Working in over 100 countries, we connect teachers in local communities to international experts and thought leaders, helping to bring the world into their classrooms and create a positive learning experience for millions of students around the globe. We embrace emerging educational needs, methods and trends like social-emotional learning, life skills and global citizenship, creating innovative content, resources and technology that improve learning outcomes and make teaching rewarding. Always with teachers at the heart, we curate and share new ideas. We support and train, keeping thousands of educators inspired on the path of their professional development, helping them to stimulate the curiosity of their learners and to spread knowledge. We believe in a world where all teachers, wherever they are, have the right solutions to advance learning.
Good afternoon, everyone, and welcome to the panel discussion on conversation around mental health. With this panel, we have brought together leading school heads and mental health practitioners from around the globe to share their understanding and best practices with you all. And we hope their insights will be beneficial for students and teachers alike. But before we dive deep into the conversation, let us watch a small video. I would now like to invite Ms. Vandana Juneja, Director Marketing at Macmillan Education India, to set the context and introduce our esteemed panelists. Over to you, Vandana.
Thanks, Suruchi. Thank you, everyone. Good afternoon, everyone. Welcome to this panel. Just a little bit about why we are here. On behalf of Macmillan Education, I welcome you to this discussion on conversations around mental health in school. Research and learning are the cornerstones of progress, which is why we open doors to discovery, which enables millions of educators, students, researchers, clinicians, and other professionals to access the latest insights. And the objective after that is to ensure that the world makes as much progress in this century as they did in the last. This month of October 21 saw the release of UNICEF's flagship report. I hope people would have glanced at it. It's called The State of the World's Children 2021, and spotlights the mental health impact of COVID-19 in children and young people. We all know that through the pandemic, the children suffered from isolation, disruption to their routines. They had concerns for family income. They suffered loss and deaths in the family, everything which left them afraid, angry, and anxious about the future. The UNICEF survey, which was conducted across 21 countries, showed that an average of about 83% young people across the world said that it is good to seek support for mental health problems, whereas in India, only 41%, which is less than half, thought so. The report also notes that as the pandemic heads into its third year, the impact on children and young people's mental health is not just going to be for a longer period of time, but it's going to be heavier. This report calls for commitment, communication, and action as a part of a comprehensive approach to good mental health. However, it is not just the pandemic which has brought us here. There was the Indian Journal of Psychiatry in 2019, even before the pandemic, which spoke about 50 million children in India being affected with mental health issues, and 80 to 90% of them did not seek support. So going back a little, it was over 6 years back that Macmillan Education India, in partnership with Fortis National Mental Health Program, spearheaded by Dr. Sameer Parekh and his committed team, took up this initiative under the Responsible Business Commitments and reached out. And over these years, we've reached out to lakhs of educators to expand their understanding of mental health. With that, I would like to introduce our panel for today's discussion. The panel will be moderated by Dr. Sameer Parekh. He really knows no introduction in the field of education, especially in the school space or in the field of psychiatry. However, I shall tell you a little bit about him. Dr. Parekh is an eminent psychiatrist and is known among social impact organizations and policymakers for his extensive efforts in advocating mental health in children and adolescents. He's the director of the Department of Mental Health and Behavioral Sciences Department of Fortis National Mental Health Program. He has a team of over 80 experts spread across 20 centers in India. And the work that the department has done has reached over 15 crore lives. He's the chief patron of the Fortis Annual National Conference and has also instituted an award called the Bharat Panchal Award for the best young researcher in the field of psychology and runs an internship program for budding psychologists or psychiatrists. On up, thank you, Dr. Parekh, for agreeing to moderate this panel with us. Among our other panelists, we've got Mr. A.P. Sharma. He's a national award-winning educationist with over 3 decades of experience as an academician and school leader. He's currently associated with Birla Public School, Doha, Qatar, as the principal. Mr. Sharma is an expert on design thinking and has worked with the Koenig Academy, Netherlands, and MIT, USA, as a propagator of latest pedagogies. He's also an expert on international benchmarking tests, and we know India is going to be participating in those, which is PISA, and others like TIMSS and PEARLS, and he has helped MOE of 3 countries in this regard. Mr. Sharma is also the founder member of the Academic Committee of QM Qatar, and he advises the Niti Aayog on the activities which can be included under the Atal Tinkering Labs. He has a hefty list of accolades to his names, like the CBSE Awardee 2010, National Awardee from the President of India 2014, and has been also awarded by UNESCO for his work around women empowerment. WEF 2016 awarded him as the Academician of the Decade and Exemplary Leadership Award from the President of India. Thank you, Mr. Sharma, for joining us today, and we look forward to listening to your views. Dr. Parthi is our second panelist. She is a visionary educationist and has vast experience in setting up schools and leading school chains. Presently, she is Director Academics at Aravali Foundation, and in her previous assignments has been with Educom, Shriram Group of Schools, and the Lakshmipat Singhania Education Foundation. She has been actively involved in building learning environments, developing out-of-the-box curriculum, and promoting experiential learning, which is what the NEP is talking about today. And she has been doing this for a very long time, even before that. She has been recognized at national and international level. Is there echo in my voice, or is it okay?
There is an echo now.
Suruchi, can you just see that the others are muted for a little while? Dr. Pathi received the International Professional of the Year Award by the International Biographical Centre, England, by the Doors to Diplomacy Platinum Award by the US State Department. She's featured in the Marquis's Who's Who book, Honoring Successful Individual, and has received the Excellence in Education Award by Rajiv Gandhi Education Foundation. With all this aside, how I would describe her is a very gracious, warm, futuristic, and collaborative education leader. And she has never hesitated to give us her support whenever we have sought it. Thank you very much.
Thank you, Vandana. Thank you.
And our third panelist, Ms. Sangeeta Cheema, is the principal of Amity School, Dubai. She's an education practitioner, again with over 30 years of experience, which includes 18 years in school leadership. Ms. Cheema served as the first lady head of the Lawrence School, Lovedale, the RKK School, Jodhpur, and has been the founder principal in 3 progressive schools which are doing well: Greater Valley School, Noida, Greater Noida, the Billabong High International School, Noida, and GEMS, New our own private high school, Sharjah. Ms. Cheema has also been awarded the School Leadership Licensure Certificate after an assessment recently conducted by the Ministry of Education at UAE. She's an empaneled principal assessor with NABET and has served as the head of curriculum and training of the Shiv Nada Foundation. Successfully managed institutional projects which are not just around infrastructure, but around curriculum design, assessment, evaluation, and pedagogy. She's a master trainer in CBSE's Adolescent Education Program, which is our focus in this mental health program as well, and empaneled by the CBSE chairman to inspect new schools for CBSE affiliation. Thank you, Cheema ma'am, for joining us today. Our next panelist is Ms. Katie Frost, an experienced learning and development consultant who's joining us from UK. She's working across multiple industries, including education and publishing. And as a trainer, she takes a very unique, psychologically informed approach to design and deliver a workshop, whether it is to meet organizational or individual needs. She's interested in helping people give off their best and addressing the emotional as well as the practical barriers that can hold people back. Experienced in the use of psychometric tools to support people in coaching, she's passionate about learning and promoting mental well-being in her practice. A member of the Association of Coaching, she's trained in cognitive behavioral coaching, MBTI, Thomas profiling, and motivational interviewing. Thank you, Katie. Thank you so much for joining us today. Our next panelist is Mimamsa Singh Tanwar. Again, someone we worked extensively with, who is very familiar with Indian schools, their working, supporting educators. She's a clinical psychologist with the Department of Mental Health Behavioral Sciences, Fortis Healthcare. And she's also the author of the mental health curriculum, which Cheema ma'am, you were just talking about. For teachers, she's a cognitive behavioral therapist working in the clinical space using evidence-based treatments for adolescents, parents, couples, and families. She provides supervision and assistance as the lead clinical psychologist to enhance therapeutic care across the 20 centers of Fortis. She's been actively engaged with schools, NGOs, and corporates through workshops and trainings to make mental health a priority for the young members of the society. Mimamsa, not just welcome to the panel, but thank you so much for the wonderful work you've done with us. She's been a speaker at various national, international fora on issues related to mental health and is a TEDx speaker. She's also authored 2 books on how to engage with kids while working from how to engage with your kids. And don't worry, here's how you can keep your mind fit during pandemic. With that, over to you, Dr. Parekh, to take the entire panel forward.
Thank you. Thank you, Macmillan, for taking time out for important conversations. For the past several years, I've been continuously talking about how everybody needs to chip in and everybody needs to hold the chisel in their hand when it comes to changing the landscape and the outreach of mental health. So, in that context, as a publishing house, your role in enabling the right voices reaching the community is a very, very important initiative. And that's why we continue to work so closely with Macmillan Publication. And like we talked about, that the curriculum, which was written a few years back, is reflective of the progressive thought process of the way we look at how mental health needs to be looked after and the support that we've received with Macmillan. So, on that note, let me also start with the very conversation that we started with, which is looking at what the UNESCO report said and reflection on the theme of this year's World Mental Health Day. This year's theme for World Mental Health Day, as most of you may be aware of, was mental health in an unequal world. And if COVID had any impact on us, then we should be able to introspect and accept that the world was an unequal world when it faced a huge challenge. And in those inequalities, children continued to be unequal more than probably any other population. Even today, as we look around the world and we look at mental health, 75% of people who need help don't go to seek help because of stigma. The UNICEF report talks about 1 in every 5 children and adolescents have some kind of mental health concerns which are rarely addressed. From high income countries where there are 70 is to 1 lakh ratio of mental health practitioners to low income countries, it falls down to 2 in 1 lakh. Depression is the single largest illness in the world, 5% of the world's population having depression. When you start looking at some of these things, the question that should come in our mind, we didn't need COVID to remind us that, listen, mental health is important. Mental health has been there as an underlying epidemic, so as to say. And now is the time that the COVID learning should be imbibed by all of us, and we need to look into the future. And I have said this especially for countries like ours, where expert deficit is there. What is the solution? The solution is you look at those parts of your communities where you can make an impact by utilizing trainers. And there is no safer, no other more constructive, well-defined, safe, productive, constructive place than a school is. Because you have children for over a decade, plus minus, in a structured environment with trustworthy people. And if there we can bring in right kind of mental health conversations to change the attitude towards mental health, that probably is one of the goals for the future and shape mental health for generations to come. And that is going to be the core of our conversation today, where we'll learn from all the educationists, experts, what can we do? What are the solutions? What are the best practices that we can both learn from and implement, not just in our schools, but across? So, for all the educationists, especially, and parents and teachers who've logged on, let's have a conversation. Feel free to write in your questions. Feel free to write in your comments. We'll be happy to take your questions to our panelists. Mr. Sharma, I'll start with you. COVID has had its own experience. You had experience with both the curriculum and the aspects of life skills. There have been various evidence-based programs. So your thoughts about, is mental health curriculum one of the way forwards? How do we integrate life skills? And your other thoughts related to COVID's interface with mental health when it comes to children.
Yeah, thank you. First of all, Vandana ma'am and Dr. Sami. It's a very interesting. Like you said that there is a stigma that people generally don't go to doctors. So it's better that doctors propagate and train people, train teachers who are closer to them. Children will not mind going to teachers, or teachers, when teachers get an integrated curriculum program, maybe 1 hour, 2 hour, whatever be the process, or whatever is the amount that you really classify, then it is essential that under the guidance of experts, they can really check. First of all, they can assess the situation. Not only they can assess the situation, they can verify certain kind of things, that which are the things they can handle and which are the things which are out of their hands. Because too much of experimentation after the COVID is very risky. As we already know from data, what Vandana ma'am said, you expressed that in India, 40% people think that they should take an advice from a doctor or psychiatrist on mental health. This is still quite good. In normal days, it used to be hardly 3 to 5%. So, COVID has made us understand that yes, there are some psychological point of view which are very much related. When the child is at home and is not socializing, unable to socialize, then need something. And till the mind is there, mindfulness is there, mental health is required. And the other parts health does not affect that much to the mind, but the mind which is not healthy affects whole body. People lost their lives because of certain kind of mental stresses and all. And it's very good nowadays that many celebrities are coming up with their problems and telling that they were going through depression and they come out. So it becomes inevitable that school should tie up with certain kind of agencies and people like you who can really tell them that how to deal with the situation, because this is just initial situation when children have started coming to school. Fortunately, in Gulf, almost 100% students are coming to school. But yes, parents are still a little bit scared. Sometimes they are asking teachers, is my child fine, okay, everything. We certainly need guidance, and it should be into curriculum. We have started in curriculum from since September. We reopened the school, so every twice in a week, our teachers have been trained, and I'm quite sure that your guidance and your advice will certainly be very helpful. And there is no doubt about that. Health education is part of curriculum, and mental health, I think, obviously takes a prime position into it. Unmute Dr. Samir, unmute yourself.
Thank you. Thank you for those opening comments, and quite true. We need to integrate mental health in school education. I think all of us would agree on that. Goes without saying. We need to look at the how, not the why. The why is obvious. And if at all there was any doubt in the why, COVID has clearly exposed it to us. And it's so important that we realize the importance of integration. In fact, while we talk about schools, and I've been saying in other platforms, whether it is healthcare, whether it is corporates, whether it is NGOs, no sector can be left untouched in their contribution towards mental health. And I think that has to be our approach. I'll come to you, Dr. Parthi. Your thoughts about this. I mean, children have had their struggles. Inequality. I mean, we've had children who were able to go through online classes, but far many more children who did not have access to the digital world. So inequality has been there. Now, when we are gradually opening up and we'll be able to bring more equality, but there is a mental health concern which needs to be addressed, let's say, for the next decade or two.
Yeah, I think there was a gap between the privileged and the less privileged. The gap is now even wider now. It's very evident because these children who are from the less privileged backgrounds have not had access to any kind of education, most of them in last 1.5 years. So that gap is definitely a concern that we need to see as a country, rather as an entire world has faced this deficit. So let's see how we need to cover up this, and also look at the mental health of the children when this gap gets wider. But there is a bigger concern, Dr. Parik, I want to bring on the table. Today, we all talk about mental health, children being glued to the screen, children being, I've seen in our own school when children have come back, they've stopped making an eye contact completely. They're so either looking for screen, they have forgotten that they're live faces and you need to make an eye contact because of that switched off camera in the classrooms. So that's a bigger concern that we have besides this concern that you're raising. The other concern is we all talk about internet पे क्या देख रहे हैं मालूम नहीं है, internet पे क्या देख रहे हैं मालूम नहीं है. But there is still another side nowadays, which is called the dark web. Yeah, which is a bigger concern again. Last, a fortnight back, somebody known, their teenage son committed suicide, and the entire thing was planned on dark web. Yeah, and the posture from which he will jump from the fourth floor, he had kind of integrated it in his mind. Yeah, this child was supposed to go to Vancouver a week later for his higher studies, but he decided to jump from the fourth floor of his house and commit suicide. So, look at the mental state of the child who is also deciding that from which angle. Before that, he passed on the passwords of his entire everything to his mother at around quarter to 3 in the morning. He received his father who had come back from a trip at 12 at night. He told his mother to go to bed. So the mental health of that child and comes from a privileged family. So today there is mental health danger everywhere, whether it is privileged, less privileged, children who have attended school, have not attended school, children who are now facing the physical world, how will they cope up with the physical world now, the real world, and children who are logging onto the internet, where our population of parents is not so literate when it comes to technology, and children are logging into sites like this dark web. So these three concerns is what we need people like you to, kind of help us out with.
So, definitely, I mean, let's understand a couple of things here, and I will take other colleagues as well. But let me put one perspective here. Worldwide suicide prevention is very much one of the top agendas of healthcare providers, WHO, UNICEF. Everybody is working. For a lot of people who may know, 10 September was World Suicide Prevention Day, and the thought process was what actions can we do together, the collective action. And I think that has to be the key when it comes to prevention. The other aspect that you mentioned, and I want to uh, invite all education, especially media literacy, has to be integral to our communications. The reason why media literacy is important is because as we go by, move forward in our lives, we'll have more and more intrusive internet, we'll have more and more accessible, we'll have more and more intrusive social media. Well, let's accept it. So, empowering children with the right kind of skills to navigate, that is our best case scenario. We won't have a situation where we'll say, listen, go switch off, because the fact is it'll not be in anybody's control. Moving on to you, Sangeeta ji, your thoughts. You've also, as an educationist back in Middle East, how have you seen the interface of COVID, children, mental health, and your thoughts for the future?
Dr. Samir Parekh, I think I am, like all of us are, in the center of the storm. And a lot of what we feel and think and do will impact that little world of children around us. I appreciate that you had a curriculum going well before the pandemic. If it was 6 years of work, I think you've got, the start up absolutely on time. So now it's ready to go out, as I can see, and perhaps it's been already implemented, as Mr. Sharma has mentioned. I also want to highlight what Dr. Madhuri Pati just said, and there is this danger lurking around because inequity does exist, and the pandemic has expanded this gap. not only in the socio-economical status of students, children, parents, but also inequity in the learning gaps that have now got worse. If you are honest and you look into your heart and see that there has been learning loss across the entire world because of this huge impact. So, with the environment, if you have to get a bridging of those learning losses and get achievement gaps minimized, then the first step is to make sure that the entire culture, the learning culture exists. Academic mastery is achieved step by step, and nothing of that kind will ever happen if you do not focus on the real issue of mental health and student well-being, including adult well-being, parents, teachers, educators, everybody. So there is this huge responsibility. It's like, I don't know what we're holding on our hands or in our heads. There's a huge responsibility that we all have. And I'm so glad that with the opportunities here, we're able to at least express ourselves across from one part of the world to the other. So thank you very much, Vandana and Macmillan, for enabling this beautiful conversation. It's important, extremely vital in our environment right now.
Thank
And
you. In fact, just as you speak, just sorry to interrupt, but lots of questions are also coming. So, how about you also answer a question that has also come because you were speaking on that very topic from Kumaram Pandian? How to handle students post COVID, ma'am?
emphasize on relationships, build relationships, just be there, forget about the academic part, forget about looking at a curriculum. There is a little secret in this whole wide world on schooling after or during this last leg of the pandemic, I would say. There is a wonderful practice called accelerate learning. But accelerate learning means you simply have to get students who are not at the grade level skills and academic levels back to what they are supposedly to achieve in their year group. So build on relationships and accelerate learning.
Thank you. In fact, before I come to Katie and Mimansa about the curriculum, one quick one, Mr. Sharma, a question that came for you. If you could help us answer this question. Uh, do you think that the ease with which all of the implementations and all happened and the way we've moved forward and now that children are going to come back to schools, what do you think is the plan for easing children back? Sahaj Kang asks this: how do we ease children back to schools? I mean, there are some who would have anxiety, both parents and children. What are the best practices based on your understanding, sir?
Yeah, it's a very interesting question because you said who will think, and that is the problem, that who is actually thinking. There is a body called CBSE. They are putting up examinations as per the schedule. There are parents who think that now their burden is over and we must send children to school, so they are not bothering us too much at home, especially the younger ones. And basically, it's a very intermingle things going on and overlapping. What we need to do is, as a principal, I can think about my school. As a principal, like Sangeeta ma'am is heading a school, and there are some other people who are heading a school, they can think about their school, but we are also governed by some other bodies who says that yes, 100% should be there, who says that yes, teaching should come, syllabus should be completed, first term syllabus should be completed. What we did in our school is that every day we kept some kind of meditation, yogas, and certain kind of things, and also try to verify it through our instruments and our special educators and counselors, where they talk to children. And during pandemic also, we were having almost every month twice a talk from the counselors and specialists to children so that they can handle their anxiety and different kind of situations arise. But yes, it is questionable. I think the principals will certainly find it very difficult when they say that as soon as children have started coming, there is a very important thing hanging like a sword on their head, is how first term examinations, means half yearly examination for class 10th and 12th, that too with a different kind of, altogether different kind of strategy, altogether different kind of pattern. There is anxiety for pattern also, that different pattern, either 1 mark or 0 mark, there is nothing between that. There are such things, and we are trying to help them out, and I'm quite sure that CBSE will certainly think about it to make it easier.
Thank you, Mr. Sharma. Before coming to you, Katie, let me just I I don't know whether you have an equivalent of what we have here in our part of the world, the board exam, which is just this thing that we've all created and successfully made a monster out of it. And we believe that it's a something that will always make life altering change for everybody listening to this now or later on. Do not forget year 2021. Year 2021 did not have the 12 board exams. The world continued to move on. These children who did not take these exams are continue to going to be on the path of success, and they are going to shape the future of humankind. So for all those thinking that the marks and is the only way, 2021 there were no board exams. Sorry, Katie, had to keep you waiting. We had our opening remarks took a little bit of time. Let me just straight away come to the question that I've been wanting to ask you. Share with us some best practices. You've worked across fields. You've also seen the impact of COVID. No part of the world has been untouched. We've lots of people have been asking questions also. I put them in a perspective. So Shweta, for example, asked that there was loneliness. There was also the fact that there was substance abuse. There are people who are asking that the impact of COVID on students and senior citizens and parents. Now, when you put all of that in light, what do you think you've observed both in COVID, and what are some of the practices that are used worldwide, and something that can be a conversation for the future that all of us can look into? Your thoughts, please.
Well, one of the things I think in the rich UK that has happened is that gap between the privileged and the underprivileged has definitely got wider. No more so is that stark in schools. So one of the things that I must say is that each school has got different issues and different problems that it needs to deal with. So whatever our approach in the UK, I think that heads of schools are focusing on, and rightly so, the needs of their schools. One of the things that we understand in other organisations very clearly, and have done for some time with well-being, is that the performance of people is directly linked to their well-being. When you've got good well-being, you get better performance. Perhaps in schools in the UK, the direct relationship between attainment and well-being hasn't fully been explored. So I think that that's an important point to mention. And the other thing, whilst in the UK we have a plethora of resources around well-being in schools, we have so much. One of the difficulties is, and this is a warning really, that they're not all landing and being maximised in the way that they could be, because at a leadership level, the leaders have not yet envisaged where mental health can be at the heart of the school, where it can be embedded fully and aligned with the learning culture, and a culture that really understands, promotes and supports understanding of mental health. And I think that currently is missing, while heads are worried about attainment and their capacity to do that. But I think that development of leading in change needs to be there. and that the different organisations involved in mental health, which in the UK are charities, local authorities, the government, parents, staff, governors of schools, mental health professionals, they need to come together and work together, and that integration isn't yet there. It's not yet there. We have different departments in government, health and education, and they have their own agendas, and they're not meeting in the middle.
Looks like all practices across the world continue to be very similar. But before I come back to all of you and ask Mimansa this question, let me quickly take a question that came here by Cindy Francis that requests you to give quick tips on how to handle students who are addicted to screen. Let me just give you a quick one on this. We've all had our own over usage of digital space. I am very much a part of it because my work became online, recreation was already online, then you had social engagement became online, restrictions of going out. So we've all gone through this. I think when it comes to helping children, first we help adults because adults need to be the right role models, learn to switch off their gadgets, have non-digital time. That's one thing. Value hobbies and other overall development. And then you help children do the same, encourage them to learn so much creative, expressive arts, yoga, meditation, plants, pets, physical activity, sports. And we need to make sure one stimulation is replaced by another rather than only saying, stop this stimulation, switch your gadget off. They need to know what else to do. And I think, Asini, that's something important. Coming to you, Mimansa, you've authored this lovely curriculum and you've authored this, what, 3 years back, 4 years back? How long back is this?
3 years back.
Two questions. One, why did you think of a curriculum then? And two, how do you make this curriculum reach the last mile?
I'll start first with your vision, because that's how you make it reach. I joined you, I think 13 years back, and the school mental health program was already in place at that point in time.
All the young people have this habit of reminding me of my age at every time I ask you the question. 13 years back, 20 years back. Fine, I'll give it to you. Go on. Facts can't be challenged.
You need to be reminded now that you're aging. You are the elderly now in the system. So, the vision that I aligned with you was to reach the schools, and the part of the work which everyone had to do as a part of our work outside of our clinical work was to invest our commitment and our passion in schools. And it started with Pro-Social Peer Moderator program, which and still continues to be the flagship initiative of our school mental health program. And over the years, I think I just, at that point in time in 2018, with multiple conversations with teachers and with counselors and educators, I think I just brought in the therapeutic element to it, where I realized that we are talking about learning disability, ADHD, and neurodevelopmental disorders. We are talking about life skills in children, and training webinars and workshops over there. But empathy becomes restrictive if there is lack of awareness. So the element of mental health that needs to be understood, which encompasses so much more, and the educative element that you bring in when it comes to mental health and understanding mental illnesses, is something which is so much more important, that the education that we use as a tool, teachers, which you already have that relationship. I mean, they're not overly invested like parents. They don't have so many expectations like parents. There's this relationship which is already there, which already has that trust that you have with a clinical expert. You go in, you have this person that you trust with, and you talk to them, and you build this over there. But even for teachers to understand the element of mental health is so much more integral and important. I remember initially when we started, the training of mental health curriculum, so many teachers and educators later on would come in with a teary moment that, we did not know that we were perhaps also struggling with mental health related concerns, because we were not aware of what is mental health particularly, and the element of mental illness. So I think that's where the mental health curriculum comes into place, where if you know that, yes, what is mental health, you're able to break that stigma. And so the 5 modules that came into picture, understanding what is mental health, understanding what is mental illness. When you understand that, you're able to break the stigma. You also redefine the language that brings in so much more stigma and so much continues to perpetuate the stigma and has been there for decades. So how do we redefine that language? And that happens when we are aware. And so when we are able to deal with these 3 elements, we are able to raise the help seeking aspect. We are able to encourage people to talk about it. And that's how we build a culture of well being and positive mental health within the classroom and in the schools. So this is what our mental health curriculum is about.
Okay. So, no, before I go to all the educationists, just one last thing for you. What are your modules? One. Second, tell me, how do you implement this? Because the big question is hundreds and thousands of schools, millions of kids. How do we reach the last mile? How do we reach that every child, irrespective of geography, background? So tell me quickly your modules, but more importantly, how do we ensure that it reaches there? And then I'll go to all educationists and then hear what Katie has to say about your curriculum.
So the 5 modules that I already spoke about, first is understanding mental health and mental illnesses. The second is how do we destigmatize mental illness and how do we reshape the social language of mental illness? How do we encourage and promote help seeking? How do we build resilience? And through resilience, we establish the culture of well-being within the classroom. How do we do it? Through teachers. And that's by training the teachers, by helping them understand all these 5 modules, and then they bring in the element of everyday conversation with the students within the school system, where it's not just about having that class of mental health, but it's about how it becomes a natural parlance of our day-to-day conversations with our children. That is what is very important, that we need to reach out through this curriculum, and we can do it online, we can do it in physical space. Then we come out in the physical space, it can be done, and we've been doing it online. I mean, in the last 1.5 years, we actually have been doing online. We've been able to reach out to a lot of schools and teachers for that matter.
So I think an important message for everybody listening here, the mental health curriculum is a simple 5-hour training module which can be spread across at the convenience of your respective school. This is a unique initiative that by the Fortis School Mental Health Program, Fortis Healthcare, and Macmillan. It has no cost to it. It comes out of commitment and passion of taking mental health for each and every child. Drop in a message to either Macmillan or Fortis School Mental Health Program, and Mimansa and her team of experts will be happy to take these sessions. Now let me go to the educationists. I'll start with you, Dr. Parthi, first, and then come to Mr. Sharma. Mr. Sharma, I know you have to leave as well, and so I'll come to you as soon as I can. Although we will extend this conversation slightly. For those who can be here, please continue to do so, because it looks like there is so much to talk about. Dr. Madhuri Bharti, a question for you.
Sure.
We all understand that mental health training should be done. I've not had any conversation with any group of people who don't accept the need of it. Yet somehow we don't implement it. How do we bridge that gap between our understanding and our action?
All right. I think, Dr. Parik, somehow mental health in our country, in this part of the world rather, has been taken as a social stigma, right? It's like you have cancer, it's okay. But you have a mental health issue, it's a problem, right? This part of the world has always treated mental health in that band. So coming out of it will take a very long time. I was watching on, I think, Netflix, that secret of that Burari murder, that 11 people who committed suicide. I mean, it was horrifying. This is a state of mind that we live in our country, where 11 people, 3 generations, decide to do just something out of the blue. The whole family decides to do what they did. So, in this country, at least, it's going to take us a lot of time But as we all agree as educationists, school is the best place where it can happen, because we are dealing with masses here. We don't have to go door to door. We don't have to go house to house. We don't have to go person to person. We have to make our children right from childhood feel it's okay if there is a mental health problem. Just like you go and see a doctor, go and see somebody. That's all. It's like any other illness, treatable. It's not a stigma. If as educationists, if our school counselors, if school leaders, if school teachers can give that comfort and assurance to students that it's like flu that you get, it's like pneumonia that you get, and you take a medicine and you're fine. It's exactly like that. You need to talk it, you need to discuss it. Families need to talk about it, and and school, there could be no better place than school.
Absolutely. There could be no better place than schools. In fact, for those who are listening, let me tell you a little bit of a story of Papagino. We keep talking about a lot of negatives that are around us. But Papagino, a Mozart playing magic flute, young Papagino feels that life's not good enough. And Papagino's friends take Papagino around. And by the end of the play, Papagino realizes that there's so much in the world which is worth living for. And that's something that we need to keep reminding ourselves every time we experience something negative. There's a lot of positives out there. Mr. Sharma, I know you have a ministry meeting. So, very similar question to you, sir. There are hundreds and thousands of kids, thousands of schools. We all understand mental health is important. We all understand life skills should be integrated, but they are not integrated across the board evenly. Some do more, some do less. To say that all schools do it, I don't think it's true. And not in a structured manner, right? Similarly, we all understand curriculum is there. Some schools are, some schools aren't. What can we do? And if you can look into the future and tell us, how would the future ensure mental health for all when it comes to children, sir?
That's a very interesting question, and I have, other than you, two stalwarts. I have read Mimansa also and Madhuri ma'am also. I've read their things, and sometimes we've seen them YouTube. The basic thing is, one day one child came to me, and he said, "Sir, since I started going to a psychiatrist, so in the class, teacher asked, Beta, where are you going nowadays?" So he said, "I'm going to a psychiatrist for mental health." And now after that, they started calling me mental. This child came to me and he said, "Sir, they are all calling me mental. Why don't you change the name of mental health to something else?" That was very interesting question, because if you remove mental health from that, then mental is very negative word. And very interestingly, that now things are reaching out. But yes, still there is a lot of scope in the villages and all, where if there is a mental health problem, they think that okay, ये तो कोई ऊपर का हवा है, and they start treating them from some kind of ojhas and all those kind of things are there. But yes, fortunately, in the Gulf and the progressive schools, this problem is not there. People are coming up, but just integrating and buying the books of Macmillan is not enough. The most important thing what you are doing right now is most important, that must reach to the principal, must reach to the teachers. So it's not like Neem Hakim Khatrejan. Means they should be treated, they should be trained properly. If you are having a five hour curriculum, then these teachers deserve at least 1.5 hour, half hour, three times that monitoring, as well as the what are the outcomes. Until and unless that is done, then this integration will remain. We know, I and Sangeeta ma'am know it very well. When CBSE talks about integration of art, integration of physical education on papers, most of the schools do, but actually they don't have time to cover the syllabus. That is a big thing. But this is need of the hour, and I'm quite sure Mimansha and Madhuri ji, and of course you, will come out with certain kind of things where you can reach out to those areas which are digitally divided and are not actually watching, even not actually they are exposed to such kind of things where they understand about the mental health. But yes, whether it's a child of a village or a child of a metro or a child from Gulf, all of them need some kind of assistance. And before that, very interestingly, it's very important to train parents, because parents are also having mental health problem, and the parents mental health affects child's mental health. This is a kind of active and passive, both things are going on. So try to address. I'm quite sure all three of you are listening, you will prepare at least one lesson for parents also, so they understand what is mental health, they can cure themselves, and they can understand their children. Thank you so much.
Thank you, sir, and thank you for being here. I know your minister's meeting to go on. Please remind them, since they are also educationists, think about mental health for all. 10th October was World Mental Health Day for a reason, and they should mark it in their calendars and do something constructive for children for
Very
generations to come. Thank
interestingly,
you.
very interestingly, Dr. Sameer, this is one of the agenda point.
Then very much. Then please say a hello to them on my behalf and tell them 10th October should not come once a year. Make every day a
Yeah.
10th October. So thank you, sir, for being here. Appreciate it. Thank you. Lots of questions have been coming in. So how are we as teachers and the heads of school going to get trained? Like I said, this is just one of the curriculums. Obviously, across the world, there are several curriculums. The idea
But
is that
I
mental.
would,
Yes, ma'am, just coming to you in a second.
yeah.
So the idea is to actually have various, whichever curriculum works to be integrated in school. You can pick up what you think you can pick up, and that's the way forward. Now, that's an answer to you, Vela. And now coming to you, Sangeeta ji, very similar question. Um, isn't it true that even though we talk about the fact that there was a significant urban-rural divide worldwide again, in terms of access, but even in the affluent or around these very urban areas, even their 100% digital outreach wasn't possible for children. So there was a sense of inequality. And the fact that once they are coming back to school, it does require a little bit of work done by schools to take care of anxieties, bring a sense of normalcy back. What do you think schools should be doing?
Well, I'm glad you asked me this question. Um, by virtue of being here in Dubai, being with one of the most forward-thinking education authorities, the KHDA, we have a very structured and beautiful program that is implemented right now and also in the previous years. And it seems to have got a better life because of the challenges that we are facing, really steadily overcoming. To tell you the truth, for the last 1 year, our school has been on campus. And it's because of the very careful, stepwise conversion from distance learning to on-campus learning, following all very important safety protocols. Now, leaving that aside, everybody has been disrupted, and the idea that remains with all schools is to measure well-being. We must have resources to measure well-being so that we know exactly in numbers where we are. So the KHGA and our school, the Amity School Dubai, we've been following the PERMA survey. We do a census every year, every 6 months, and we have an action plan based on our figures. The data speaks for itself. We also have a CASTLE competencies incorporated into a mindfulness curriculum that we call. So it's a very spirally integrated curriculum already existing with the CBSE curriculum. So a curriculum that exists as a toolkit, as a guideline, or as a handbook can always be integrated with the existing curriculum of any particular nation or area. So the CASTLE social emotional learning framework, which has self-awareness right on top, followed by self-management, social awareness, relationship skills, and responsible decision making, all put into a system, can be measured. And once we are aware, the entire system, the teachers and the school leaders, the governors, as Katie said, can be part of that process. So it's a systemic change that's required, and we should work towards it. It's not difficult.
while you were speaking, Sangeeta Kadian wrote, I feel the most important aspect is acceptance. If we accept, only then we'll be able to implement things. So, your thoughts being echoed by people listening to you. Coming to you, Katie, I was very keen to understand from you what I was reading, that this absolutely wonderful exercise that you do, the boat and the water line. How do we let a storyteller go without telling us a story? Especially when we are talking about children and teachers, and we're all up for good stories. So tell us
Well,
about the boat and the water line, please.
yeah, the boat and the waterline exercise. The beauty of it is, it's to do with raising awareness and getting people to talk about their own well-being. It's ever so easy to talk about everybody else's mental health, but let's talk about our own. And so I do this exercise with people of all ages. Okay, so my 90-year-old father and young children and so on. And what we do, we get a blank piece of paper and we draw a little wavy line in the middle of the paper, and that represents the water line of our well-being. And it's getting people to talk about it, and it's fantastic because we can say, what does that look like for you? What does it look like for you? What does it feel like? What are the things that you're doing when that water line is in place? And that's very empowering for people to even step back and think about that. And then after we've drawn that wavy line and we've thought about that, we start to draw some downward arrows on the line. And then we ask people, what are the things that push you down below that water line? What are the things? And they're different for different people. So some people will say my sleep, or the way that I'm eating, or, if I've had an argument with a friend, or whatever it might be. It doesn't matter what they say. It's them tapping into what they understand pushes them below the waterline. Then the positive bit is you then look at drawing arrows below, and you start to examine all the things that help to support and push the person above that waterline. And it's different for different people, and they'll tell you, well, when I play rugby, or when I am sleeping better, or it can be absolutely anything, and you want to tap into that for that individual. And then they've got a whole picture actually of what impacts their well-being. And then you're taking an interest, and you can include questions like, well, okay, so how can you build on the things that push you up above that waterline? What can you be doing there? How can you use those things that you've discovered about yourself? And they get interested in that. And then you start to say, okay, look at those things pushing you down. Which ones of those do you think you could influence, no matter how small? And they think about that and what the relationships are. So I think this is a very healthy way to get, I must say, people of all ages, including teachers who don't like always talking about this stuff still, okay? Because it's all right to talk about the pupils and the students, but when it comes to talking about me, obviously I don't have a problem. Yeah, we need to really help people to have an intelligent conversation. So I've got it on a PDF, and I'm willing to share it with anybody.
Absolutely lovely, lovely. I will, what, Katie, if at all you end up listening to one of my talks, or somebody telling you that somebody from India was speaking about the boat and the water line, I may have just stolen your idea, because I just love the story. And this story is going to be narrated by me to way too many people. So before I start coming to all of you for your winding comments, I didn't realize we crossed the 1 hour mark. But Mimansa, there are just a couple of questions. If you can quickly answer them as short as you can. Shishi Bhargav asked these very important questions. How do we attempt to reach children from underserved sections of the society, the marginalized sections? Should mental health professionals learn new modalities and competencies? How can we get social workers integrated? What can mental health practitioners do, especially for the marginalized areas of the world? And then I'll take closing comments from all four of you, please.
More collaborative work with different parts of the society, which means your NGOs, your Anganwadi workers, different aspects. Wherever you can, start training psychological first aid, basic counseling skills. These are some of the most basic things that we can train ourselves into, equip ourselves into, and keep giving it to people around us in all sections of the society.
Okay, that was nice. But I must tell you, Katie, the feedback for your story is wonderful, wonderful activity, marvelous, excellent. I've been getting lots of messages individually also. So yeah, this story is going to be a hit. And yes, I have the PDF in any case. For those who want, I have the PDF. Right? The Katie Stories PDF is right with me. Okay, so let's start taking some winding comments. 10th October was World Mental Health Day. Worldwide, October is seen as the Mental Health Awareness or Mental Health Month as well. This year, the theme was Mental Health in an Unequal World, where all of us realize that COVID exposed our inequalities. But all of us also realized that mental health continued to be treated unequally in healthcare by all of us in our primary well being overall as well. So the thought came, how about having conversations with various stakeholders? And here, the stakeholders coach, clinical experts, educationists, teacher community, a publishing house, media coming together to have a conversation. What can we do? And those that is going to be my question for all of you experts. What can we do? Starting with you, Dr. Madhuri Parthi, what can we do for the next decade to have a positive impact and mental health inequality to be taken away?
Dr. Parik, I would again emphasize on that same point that school, there could be no better place than school. The issue right now, as I said, is that it's a social stigma. The vocabulary that our teachers have for children with learning gaps, with mental illness, even our teachers don't know what vocabulary to use, what not to use. Forget about the entire, this side of the world. These are teachers. But it is very difficult, they label any child as a special child. They will label any child as a anything. And Three Idiots have done one great favor to all of us. Everybody thinks they know the entire story. They just understand children better than anybody else under the sky. So that, I mean, there is a flip side of that movie, and there's a, of course, like a coin, it has two sides. So educate, 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 and start it in schools like this whole organization which is here, like Fortes and Macmillan, what they've done. Schools, this is the best place to do it. Thank you.
Thank you. Coming to you, Sangeeta ji, but I'll just quickly respond to one point that just came. Nelson Chaudhary, you asked how many schools have a full-time child psychologist. I need to emphasize that we overall have a 500% shortage of experts in our country based on the worldwide ratios that are there. And that applies to most developing countries. And that's why expertization, I don't think, is a solution for mental health. It's training more people and involving them in the process of mental health, especially teachers when it comes to the school community, which is one of the solutions. And that's why the conversation on mental health and mental health curriculum. Sangeeta ji, your thoughts. You're a principal, you are an educationist for what, couple of decades, you've seen it all, and yet COVID came and told us that there was something we hadn't seen. Your thoughts, how do we bring a change, a long-term change, and into the next 10 years and making well-being a priority for children? You'll have to unmute yourself, please.
Yes. So, with what Dr. Madhuri Parthi said, the whole process has been summarized very conscientiously. I really appreciate that. But let's look at the question that you asked. A very creative and innovative curriculum that has embedded SEL practices, mental health and well-being systems is the solution. You can't have a demarcated system working with separate parallel roads. It's got to be incorporated and integrated.
I think that's a very important voice that is saying it most unambiguously for all policymakers. Important message by Sangeeta ji. Integrate it. Katie, before I come to you for the last words, Mimansa, your thoughts. I mean, you've done more training than a lot of us on mental health curriculum with teachers. When you take a mental health curriculum with teaching community, how well is it taken? Is there still resistance, or the resistance is only in our mind, but it is very much implementable?
I'm going to start with three A's, Dr. Parekh. One is being open to be aware of the fact that we may not know a lot of things, and that's where it starts. Awareness is the first step. Accepting the fact that, yes, we need to include it, we need to be more aware is the second, and the third is the action. So we've been doing all these three, and people, schools, teachers, even principals and educators that we've worked with have been very much open to this. Not even a single person that I've heard have said that, this is not applicable or this cannot be integrated, because it's as simple as it gets. Just be aware of it, just accept it, make it part of your day-to-day communication, conversation, and just integrate it in that way.
Thank you. Just integrated and action. If acceptance and awareness is then the only A that is left is action. Katie, how about you winding this conversation for us? You've heard from all of us. Um, Give us your perspective and peep into the future for us.
I think you are amazing, all of you. And I think you've got a fantastic opportunity right now. I think you're pushing at an open door. And the reason is that the one thing that COVID has taught everybody is that mental health matters. It matters to each of us individually and in our families and in the communities. Nobody has not been affected by this pandemic. And I think that the awareness is already there. And I think it's about engaging people in conversations, intelligent conversations, continuing to build that awareness and helping them to understand how we've got things like the mental health curriculum that really could meet some of the needs that they've already identified. We've got to look at where they're coming from and meet them there.
Yes, very, very, very important words. As we look at winding this conversation up, I just echo what I hear. And what I hear is we accept it. That pause shouldn't be there. We accept it. Now let's implement it. And I do feel evidence based, standardized, structured, measurable, implementable, which can be easily implementable across the socio-economic divide. That kind of an approach of mental health, and why mental health in schools? Because that's the longest an individual is in a structured environment. It is our safest environment, most trusted environment. Teachers shape lives. All of us here have been shaped by teachers who came across our way. Teachers shape lives. And teachers, when it comes to mental health, to be honest, is the only hope that we have in making an impact. It's not the psychiatrists like me or clinical psychologists like Mimansa or coaches like Katie, it's teachers. Teachers are going to make the impact. So let's think about it. And yes, for all schools, anywhere in the world listening to this, if you want an insight into mental health conversations and want us to conduct a curriculum, just drop in a message and we'll make sure that somebody will reach out to you. The idea is we need to reach each and every child in the world. Mental health for all. On that note, thanking Macmillan, especially thanking Macmillan for being an absolutely wonderful, gracious partner in our journey for the past decade in taking mental health to schools across India. And on behalf of Fortis School Mental Health Program, a thank you to all of you who've been here. Lots of questions are still coming in. You can drop in the questions and we'll make sure somebody, one of us will be able to send you the answers. But it was, we planned for a 60-minute conversation. We've reached the, uh, crossed it by 15 minutes. I know this can go on and on, but we'll wind it up here. Choose actions that matter is our message to you all. Thank you, Dr. Madhuri Parthi.
Thank
Thank
you.
you, Sangeeta Shimaji.
Thank you.
Thank you, Katie. The boat and the water line is mine. And thank you, Mimanta Singh Tanwarji. Absolute pleasure to continue to learn from you. On that note, good evening. Stay safe, stay positive,
Thank you.
choose actions that matter.